Yeah, so save me life and stress. I'm so stressed. In fact, that's the major reason why I want to train. Not even for anything, not for the money. I want to recruit people that I train to an extent for my 2022 project. So that's it. So basically today we want to talk about ulcer, hypertension, and diabetes. You understand? So you can start writing, please, because we are going to summarize it for them. Yes, ulcer, hypertension, and diabetes. Now the reason why I chose these three together is because it's something that, you know, it affects lots of people. And like this ulcer thing, after I teach you guys are going to earn, you are going to do a challenge. You must earn 20,000 naira next week. You understand? Remember I said the class is about practical. Me, I don't do have 5,000 people in the class and just do chap and go. So it's a practical class, so that tomorrow if I'm very busy, I can easily say, hey, take care of this my client, and I'll be confident about it. You understand? So now ulcer generally, a lot of people say ulcer is being caused by H. pylori. H. pylori, H dot then Pylori. H. pylori is a bacteria, you know, that causes ulcer. But the thing is this, not everybody who have ulcer actually have H. pylori. Not everyone who has ulcer has H. pylori. So that's why you see some people, they will go to hospital, they will do tests, then the doctor will be like, there is no H. pylori, but the person is sick, and you'll be asking, what's now the problem? Okay, so that is because there are some people that their blood group predispose them to ulcer, and 80% of them are O positive. Now your assignment is going to be this: when we do our project, you will ask people, you will tell people that you want to do free fruit therapy for 20 people with ulcer. That's not your number one project though. Now you will get me the blood group of people that are there that you know have more of the ulcer. So when you are getting history, you are getting their name, you are getting their age, but most importantly the blood group. Okay, so when you have gotten the blood group, the first project is to submit the percentage of O positive or O negative. Don't do whether it's positive or negative, just O, A, B and AB. So you give me each percentage of the blood group that has higher rate of ulcer. You will now submit. So now this assignment is to be kicked off immediately, so that when you submit to me next week, we will now be able to see the next line of action while you are doing your therapy. So the first project is to do free fruit therapy training for 20 people, only 20 slots, free, which you are going to teach them. You are going to do an assignment to read about ulcer, and then you are going to teach them how to manage their ulcer with fruits and diet. Then you will now sell a product. So you will sell a product. I would find a way to put a product that is very, very affordable. You sell a product to them, they use it, and then they continue with it. So you sell a product, and then you sell a fruit therapy plan for them. So it's going to be 2,000. 1,000 will be for the fruit clinic. 1,000 will be for you. So that myself and you will draft something and give to them. But we need to know their blood group. So it will be 2 days free training. The first day training is going to be about blood group and how blood group can influence their ulcer. Then the other one will not be about the food therapy. So now, after getting their blood group, the next thing you want to know is the kind of food they eat and their stress level. Most of the time, if O plus people, you know that, okay, you know generally that O positive or O negative, generally they are predisposed to ulcer because naturally their body have a very high stomach acid, so they can easily digest stuff, but they have ability for acid reflux. So if they don't eat more of alkaline food, if they eat more of acid forming food, what are the acid forming food? Majorly protein, because the end product is what? Amino acid, right? So the way to know acid forming food is by the end products. So second assignment is look for acid forming food and alkaline forming food. Now, things like milk are acid forming food, and too much meat. So if you are helping somebody with ulcer, you are going to tell them to stay away from milk for the first 1 month to see how well they will do. Number 2, you will tell them to reduce fried things, because fried things can actually give the body more energy for digestion. So when something is fried, the body is being stressed. That's why you see some people, when they finish eating oily thing, they will tell you that, it is after I finish eating that fried rice that I just started having chest bone. That is because fatty food too are acid forming food, and it takes the body extra stress to digest it, leading to more acid reflux. So more stress, more acid. So you tell them to reduce the way that they fry things. If they want to cook their stew, they can use palm oil, or they don't fry the oil at all. You understand? Now, we are talking about elimination method. So we've talked about removing of milk, right? And majorly acid forming food, right? Now you tell them to stay away from spicy food, too much pepper. That is because it can also increase acidity in the body. It can increase, as spicy food are great, but it can increase acidity. So if they have ulcer, they have to reduce that. You ask them the history of taking omeprazole and antacid, and you tell them to stop. If anybody is having ulcer as a result of maybe H. pylori or high acid, and the person is taking omeprazole, what you are trying to tell the body is to reduce the stomach acid. Now, the stomach actually needs acid. The stomach generally needs acid to digest food. But if food content from the stomach escapes to any part of the body, it can cause burning sensation, because the stomach is the most acidic environment in the body. Please write it. The stomach is the most acidic environment in the body. The stomach is the most acidic environment in the body. So imagine if the stomach is very acidic compared to other part of the body, and then some food escapes from the stomach to other parts. Of course, if acid touches on your skin, you will feel burn now. So that is the reason for most of ulcer patients having burning sensation. Now, naturally, your stomach needs enough acid to digest food. Now, the mistake people make is they keep taking omeprazole, and omeprazole will be reducing the stomach acid the acid in the stomach, though they might feel okay at that time. But if stomach acid is very low, it can predispose somebody to bloating. That's why you see people with ulcer, they always have bloating. And it can also predispose them to stomach cancer. If you check one of the side effects of low stomach acid is stomach cancer. So people taking omeprazole all the time, they have risks for stomach cancer if they don't stop. So how do you now help them to reduce the stomach acid without omeprazole? Aloe vera water. Aloe vera water. Have you written it? So how do you prepare aloe vera water? You just get 1 or 2 aloe vera and 75 cl of water. You just cut it and infuse it inside the water. So anytime they feel that burning sensation, they just take a spoon or 2 and they are good to go.
Okay, please let me get it. You just have to cut it.
Yes, you are not removing any gel, you are just cutting it.